Currently in its form is non-sustainable, right, on multiple fronts. And I think we in the US are not doing great on many of these conventional metrics of delivering access to patients as well as their experiences, as well as translating to better outcomes. So the book I wrote was largely to integrate these three different aspects of clinical care and hopefully improve outcomes and patient experience. And being a clinician, I think, really gives us a huge opportunity not just to be a teacher or an educator, but also be a researcher, also be a clinician, practice medicine, but also be a leader, have the administrative aspects of how clinical medicine needs to be delivered. So from my personal experience, I think when I was the clinical chief of cardiology, I really saw that there were many aspects of care that were not delivered in the most ideal fashion. And that's where I thought I'm going to step out of this zone and write a book of how to bring this together, because there are lots of changes that sometimes don't happen very well inside the institution, so you need to bring the change from outside in.
That's really incredible perspective. And I think we all have experienced situations where we become frustrated with a problem. And so thinking in a different way, right? Instead of trying the same thing over and over again, expecting a different outcome, and really thinking on a broader scale, sometimes super helpful.
Totally. And since you mentioned about, collaborative care, I think that is so important in medicine right now. If you're an interventional cardiologist and, I'm an interventional electrophysiologist, and if you look at the patients we see are at the top of the pyramid, who are really complex and require subspecialized care, but the larger base of the pyramid are patients who are actually pretty well, almost going to be sick. And then the bigger part are patients who actually have chronic diseases, and you and I see them when those chronic diseases get complicated. So what we need to do really to make healthcare more sustainable is to fix that wellness zone and that midstream chronic disease zone to transform how care really is delivered to patients.
I think that is a beautiful message that is very much needed in our healthcare system. Shifting to more of the clinical side of your work, what is your current clinical area of interest within EP?
So it's, again, multiple areas. I would say heart failure and its intersection with rhythm disturbances and sudden cardiac death has been very close to my heart, and no pun intended. But one of the things that I did was I created a multidisciplinary clinic where I brought the heart failure team as well as the electrophysiology team, even the cardiac surgeons and other people all engaged and involved in a clinic setting so that we could look after patients in a more integrated way. Because when each of us works in our little silos out there, like I said, if you're just working at the apex of the pyramid, you're not thinking about the patient as a whole. And when you bring all members of the team together, it really translates into a much better patient experience, but also better outcomes.
This is something that I'm very interested in. For people that are able to successfully build integrative models involving multiple specialties, what is one piece of advice that you would give someone who's interested in doing the same thing? Because it's a huge undertaking trying to get everybody on the same page.
You have to have the wherewithal, and there's always a champion to make this happen. Because not everybody is aligned initially, because everybody is thinking about what's in it for me. So if you can construct a vision that is able to explain to everybody what's in it for them, to get them to buy in, and some of it initially is just, the idea and friendships and love that you can offer them, and then as the idea builds up and translates into something more meaningful, people really start wanting to ride the winning horse. So I think it's really selling the ideology well, being passionate about it, and being ready to really, take the ups and downs and stick with it. Because getting multiple personalities from different clinical specialties, that, getting them together on the same page is very challenging.
And I think once we are able to do that, the results are tremendous. We take such good care of patients. We have a better understanding of our ecosystem within the work environment. I mean, it's a really incredible positive change. So it's impressive that you're able to do that. Going back to your interest in the heart failure space and sudden cardiac death, a lot of our audience is non-EP clinical cardiology, and we'd like to know one piece of information in 2025 that we should know about this space.
Oh, about heart failure space? So I'm a device guy. So that means I implant devices for improving outcomes in patients with heart failure. There's multiple device therapies that are coming up in the near future that will be able to take care of some patients with refractory heart failure. Some of them are like cardiac contractility modulation. Another treatment therapy is baroreflex activation therapy. A third one that I was involved in personally, we just completed a study called the SOLVE CRT study, which looks at leadless left ventricular pacing using ultrasound transmission. So it's really innovative technology. We just got FDA approved, I think, less than 3 or 4 days ago. Again, it's going to transform the way we actually individualize pacing therapies in our patients.
So we have a lot of new technology emerging. There are experts like you who are implanting devices in patients in a multidisciplinary collaborative approach. And I think that's a beautiful message for people to know. It takes a team, it takes the expertise, it takes keeping up with the innovation. Outside of EP, what is something that lights you up as a person? What do you love to do?
I love to hang with the fam. I have 2 grown-up children. They're scattered in different parts of the country, so whenever I can, I hang with them, and my wife's an oncologist, and whenever we can, we try to travel as much as we can, long walks, and read a lot. And I write a lot, so that takes up a little bit of time.
What's your favorite travel destination that all of us should go to next?
Oh my gosh, that's a tough one. I love India, being from there, but travel destination, I would say, I like big cities. I was just in Paris a couple of months ago, at London, Paris, which I think everybody knows. There's so much to do, and every time you go there, there's always something new to see.
I love that. And do you mind if I just do one quick rapid fire? It's more for the relatability, and we'll cut some of it on.
If it doesn't go well, then you're going to.
Oh yeah, well, we got you. So, what's your favorite EP procedure?
AF ablation.
And what's playing on the sound system in your EP lab?
Usually it's my kind of music. It's Morchiba, RJD2, and the other is Thievery Corporation. These are kind of non-conventional music, but I like to hear this kind of music when I'm operating.
That's pretty cool. What is on your scrub cap that you wear?
I wear a conventional scrub cap. So there's one of them used to have the MGH emblem on it, and right now it's just a plain scrub cap.
So hospital blues.
Yeah, hospital blues.